A very good evening to all of you. Today we are going to do Neet PG Medicine MCQ challenge. So please answer in the chat box the correct answer for each of the multiple choice questions. We will discuss in detail in the comment box. Please click the link in the description box to join the Ultimate Neet PG event. Which of the following is a risk factor for Alzheimer's disease? A. Apo E1, Apo E2, Apo E3, Apo E4. What do you think is the correct answer here? The chromosomes involved in Alzheimer's disease are chromosome 14, 19, and 21. The ApoE gene is on chromosome 19 is involved in pathogenesis of Alzheimer's disease, and the gene has three alleles E2, E4, and E3. The major genetic risk factor for Alzheimer's disease is E4 allele for apolipoprotein E gene. Carrying one E4 allele increases the risk. It is also called epsilon. So the correct answer here is D. The production of which of the following hormone is increased in obesity? What happens in obesity? Which hormone increases? Four options are A. Thyroxine, B. Adiponectin, C. Insulin, and D. Growth hormone. Now, obesity is defined as body mass index of more than 30 kg per meter square. Most common cause is excess calorie intake. Insulin level are increased in obesity. It stimulates the synthesis of fatty acid and triacylglycerols. Thyroxine, growth hormone, and adiponectin have lipolytic effect. Hence, their levels are reduced in obesity. Hyperinsulinemia and insulin resistance are pervasive features of obesity. Insulin resistance is more strongly linked to intra-abdominal fat than to fat in other depots. Which of the following antihypertensive drug is avoided in patients with high serum uric acid level? A. Prazosin, B. Enalapril, C. Hydrochlorothiazide, D. Atenolol. What do you think is the correct answer here? It is hydrochlorothiazide. These thiazides can competitively block the uric acid excretion in the proximal convoluted tubule, and hence the excretion is reduced. It will lead to hyperuricemia. So thiazides like hydrochlorothiazide should not be given with patients with high serum uric acid levels. All of the following are AIDS defining illness. A. Invasive cervical cancer. B. Encephalopathy attributed to HIV. C. Oropharyngeal candidiasis. D. Mycobacterium tuberculosis of any site. Now, what are the AIDS defining illnesses? The AIDS defining illnesses are cervical cancer, invasive, bacterial infection, multiple recurrent, coccidioidomycosis, disseminated and or extrapulmonary, candidiasis of esophagus, candidiasis of bronchi, trachea or lung. Remember, oropharyngeal candidiasis is not an AIDS defining illness. Mycobacterium avium complex or Mycobacterium kansasi, disseminated or extrapulmonary. Mycobacterium tuberculosis of any site, pulmonary, disseminated, extrapulmonary. Mycobacterium other species or unidentified species. Cryptococcus extrapulmonary. So the correct answer here is oropharyngeal candidiasis. It is not an AIDS defining illness. Which of the following is best treatment for ITP, idiopathic thrombocytopenic purpura? A. IV immunoglobulin, B. Steroids, C. Blood transfusion, and D. Splenectomy. The correct answer here is splenectomy. Splenectomy is the best treatment for ITP. Prednisone is the treatment of choice in mild ITP. The main point of most ITP questions is initiating therapy is more important than determining a specific diagnosis, particularly since ITP is a diagnosis of exclusion. Which of the following is true about PNH? A. Inherited defect in PIGA. B. Extravascular hemolysis. C. Deficiency of CD55 and CD59. And D. Microcytic anemia. Please comment in the chat box what is the correct answer for to this. Now, deficiency of CD55 and 59, paroxysmal nocturnal hemoglobinuria is a rare clonal stem cell disorder. It is a stem cell disorder. It is caused by defective expression of RBC membrane protein, which is CD55 and CD59. They normally function to protect the cell against complement mediated destruction. It is due to acquired mutation in X-linked phosphatidyl inositol class A pig gene, causing deficiency of GPI. Now, this GPI is a glycolipid that anchors the membrane protective factors such as CD59 and CD55 to the membrane. It is characterized by a classic triad of pancytopenia, intravascular hemolysis, and thrombosis. Chronic intravascular hemolysis results in chronic paroxysmal hemoglobinuria, elevated LDH. The anemia is usually normomacrocytic. Nasal polyp are commonly associated with A. brittle asthma, B. intrinsic asthma, C. extrinsic asthma, D. exercise-induced asthma. Now, intrinsic asthma, also called as non-allergic asthma or non-atopic asthma, it shows a later onset, usually in adult life. Patients have negative skin test and normal serum concentration (IgE). Which chamber of heart hypertrophy is seen on chest X-ray in a patient of metastenosis? A. Left atrium, B. Right atrium, C. Left ventricle, D. Right ventricle. Left atrium. Chest X-ray shows left atrial hypertrophy with normal LV. Cushing's ulcer are seen in A. Burns, B. Stress, C. Head injury, D. Cell necrosis. The correct answer here is head injury. Now, curling ulcer are associated with severe burns and trauma occurring in the proximal duodenum. Martorial ulcer are seen in patients with prolonged or suboptimally controlled hypertension. Margarine ulcer reflects malignant degeneration arising within the pre-existing cicatrix or scar. Cushing ulcers are seen in head injury. Cushing ulcers are associated with severe burns and trauma occurring in the proximal. Please click in the link in the description box to join the ultimate Neet PG event. Wishing you all the best.